Hello, and welcome to day 15 of Movember 2024. In today's video, we're going to be looking at bladder cancer. So what is bladder cancer? Bladder cancer starts when abnormal cells appear in the lining of your bladder or in the bladder wall. This can affect how the bladder works. Bladder cancer can grow in different ways. Non-muscle invasive cancer. This only affects the cells in the lining of the bladder. Muscle invasive cancer. This grows into a deeper layer, such as the muscle of the bladder wall. Advanced bladder cancer is a cancer that has spread beyond the bladder to other parts of the body. The type of bladder cancer will affect the type of treatment you need. So what are the symptoms of bladder cancer? Blood in the urine. It may be red, pink or brown in colour. Needing to pass urine urgently. Passing urine more often. A burning feeling when you pass urine. These symptoms can also be caused by conditions other than cancer, but it's important to go to the GP and get any unusual changes checked. So what increases a person's risk in developing bladder cancer? Smoking. Smoking is the biggest risk factor for bladder cancer. The chemicals in cigarettes damage the lining of the bladder, causing cancer. Age. The risk of bladder cancer increases with age. Most bladder cancers occur in men and women over the age of 50. It is rarely seen in those under the age of 40. Race. White men and women are slightly more at risk. Gender. Bladder cancer occurs more in men than women. Chemicals. Certain chemicals once used in dye, rubber, paints, plastics and gasworks industries can lead to bladder cancer. These chemicals have long been banned and are no longer in use. Infections. Your risk of bladder cancer increases if you have repeated urinary tract infections or bladder stones. An untreated infection with the parasite scytosoma, also known as bilharzia, can lead to bladder cancer. This parasite is often found in water in the developing world. Previous treatment for cancer. If you were previously treated for cancer with radiotherapy to the pelvic area, or with the chemotherapy drug cyclophosphamide, your risk may be higher. And finally, medical history. If you had a previous bladder cancer, you are more at risk of developing another one. Having a risk factor doesn't mean you will definitely get cancer. Sometimes people with no risk factors get the disease. If you're worried, talk to your GP, or talk to one of the Irish Cancer Society's cancer nurses. You can also call their support line on 1800 200 700 or visit one of their daffodil centres. So this has been Movember Day 15. Thank you very much for watching, and I'll talk to you tomorrow.